Guess what? So we're halfway there. It is day 25 of our 50 days pharmacology series where we look at different drugs and how they work. And it's important to know the drugs you're taking, what they do when they get inside the body, and the side effects that they have. So we've been looking at drugs used for diabetes, and we're continuing with drugs used for diabetes. Today, the drug category that we're looking at is sulfonylureas. That is a category of the drugs, and it is used for type 2 diabetes. If you don't know the difference between type 1 and type 2 diabetes, go 2 days back to watch my video on metformin. So sulfonylureas has first generation and second generation, and it's pretty simple. So first generation sulfonylureas is like the OGs, the original sulfonylureas drugs that came on the market, and the second generation is like the newer and improved sulfonylureas. The first generation sulfonylureas, I hope I pronounce this right, is chloropropamide and the tolbutamide, the Indian I, the tolbutamide. And second generation sulfonylureas is like glipizide and glyburide. This is what normally happens. The pancreas has beta cells that release insulin, and for this to take place, potassium channels on the pancreatic beta cells have to close. When the potassium channels close, that means that the potassium is trapped inside of the beta cells and they cannot leave, and this cause the cells to be what we call depolarized, which means that inside the pancreatic beta cell becomes more positive. And when this takes place, calcium channels open and cause calcium to enter the pancreatic beta cells, which leads to insulin being released. This is what takes place on a regular basis. Now, the drug sulfonylureas increases this taking place, so more insulin is released, and some side effects of sulfonylureas is weight gain and hypoglycemia, low blood sugar. So if this was helpful, like, follow to join my journey, MD in the making, and stay tuned for tomorrow's drug of the day.